Our current event is new blood-based biomarkers predict when ALS symptoms will emerge from the National Institute of Health. What the article is about: researchers analyzed data from the NIH-funded pre-symptomatic familial ALS study, which has followed individuals with genetic risk factors for ALS for nearly 20 years. Blood samples from 137 participants were examined using advanced proteomic analysis that measured over 5,000 proteins. Among these participants, 33 individuals developed ALS or frontotemporal dementia symptoms, allowing researchers to compare protein levels before and after symptom onset. Research identified 92 proteins that changed before symptoms appeared and used machine learning techniques to determine which biomarkers best predicted disease onset. A final panel of 19 blood proteins, including neurofilament light chain, was able to predict when symptoms would emerge with an average error of 18 months. Findings were supported by data from the UK Biobank, suggesting the biomarkers may be relevant beyond individuals with known genetic risk. What is ALS? ALS stands for amyotrophic lateral sclerosis and is a nervous system disease that affects nerve cells in the brain and spinal cord. There's currently no cure for this disease. Some symptoms include weakness in the legs, feet, or ankles, tripping and falling, hand weakness or clumsiness, slurred speech or trouble swallowing, muscle cramps and twitching, along with weakness in the arms, shoulders, or tongue, and changes in thinking or behavior, as well as many other symptoms. Some risk factors include genetics. For about 10% of people with ALS, a gene linked to the disease is passed down from a family member. It's called hereditary ALS, and most people with hereditary ALS, their children have a 50% chance of inheriting the gene. Age also is a risk. It rises with age up to 75%. It's most common from age 60 to mid-80s. It's more common in men than women before 65, and the difference usually disappears after age 70. Smoking is an environmental risk factor for ALS, and women who seem to smoke have a higher risk, particularly after menopause. Exposure to lead or other substances in the workplace, at home might be linked to ALS, but no single substance has been linked to the cause of ALS. And also people who serve in the military are at higher risk. It's unclear why, but it could be exposure to certain metals or chemicals, traumatic injuries, viral infections, or intense exertion. The importance today and relevance to healthcare. As discussed before, ALS is a progressive, fatal neurodegenerative disease that currently has no cure and limited treatment options. Early identification is critical because nerve damage is largely irreversible once symptoms appear. Researchers identified blood-based protein biomarkers that may predict the onset of ALS symptoms months to years before clinical symptoms develop. These biomarkers estimated symptom onset with an average error of approximately 18 months. Early detection may allow healthcare providers to begin monitoring and intervention sooner, potentially slowing disease progression and improving patient outcomes. The biomarkers could help identify high-risk individuals for participation in preventative clinical trials before significant motor neuron damage occurs. Blood testing is less invasive, more accessible, and potentially more cost-effective than many current neurological diagnostic procedures, increasing opportunities for early screening and follow-up. The discovery supports the movement towards precision medicine, allowing healthcare teams to tailor monitoring and treatment plans based on an individual biological risk profile. Reliable biomarkers may improve the efficiency of clinical research by helping researchers enroll participants at the most appropriate stage of disease development.
There are numerous implications that could occur as a result of this testing. For patients specifically, moving forward with this test could result in severe psychological and emotional distress. Essentially, they are given an estimated countdown to symptom onset and decline, and this can cause significant anxiety, depression, and anticipatory grief for what's to come. There is a financial and insurance component, which I will address in the next slide under legal concerns. This does allow for interventions, however. It gives a timeline to enroll in pre-symptomatic and preventative clinical trials in hopes of slowing the progression of degeneration and decline. And then as far as for planning, it essentially forces personal timelines, such as starting a family. It impacts decisions for career goals and pushes planning for completion of bucket list items. All together, overall, it just forces a timeline. For family, there is very similar psychological distress experienced, many of the symptoms I explained before, but on top of that, there is the anticipation of caregiving that can be extremely taxing on an individual. They are losing sight of the future or life that they envisioned, and the stress of how much caregiving and what will be involved in the future can be very taxing. There can be changes in reproductive choices. They might decide to go through prenatal testing to prevent passing the gene variants, or possibly decide whether or not to have children. Again, there is a financial insurance component, which will be discussed next. For healthcare workers, early preparation can begin with their timeline in mind. Therapeutic timing for trials and treatments to try to slow progression can begin. A multidisciplinary support team can be set up prior to decline, and this also allows for earlier emotional support and counseling for the patient and families. As far as for legal concerns, predictive timing tests expose individuals to higher premiums or coverage denials, creating a large financial and insurance strain on the individual and family. While there are laws that protect against genetic employment and health insurance discrimination in the United States, they typically do not cover life insurance, disability insurance, or long-term care insurance. Also, biomarker tracking through the broad health databases risks unauthorized third-party access, which impacts personal privacy and can potentially affect financials as well. When it comes to ethical concerns, as mentioned previously, this can cause severe psychological distress. A high accuracy prediction of an incurable disease with a countdown is a heavy burden to carry. Another point I read about, essentially using onset predictive tests as inclusion criteria for preventative clinical trial forces some into getting the predictive tests, even though they didn't want to know or want to get the tests originally, but now they are left to balance the hope of early intervention against the trauma of knowing symptom timelines. So there is an issue with informed consent and trial access using this as inclusion criteria. And lastly, there's a fine line between autonomy versus burden of knowledge. At-risk individuals face the difficult choice between the freeness of future life planning and the psychological weight of certainty regarding when they will begin declining.
Nurses play a very important role in the new blood-based biomarkers testing for patients, since nurses are very responsible and play a very big role in patient education and family education, whether this is done inpatient or outpatient. They're responsible for preparing patients and their family members once they leave inpatient, especially. They may be responsible for providing family members information about this testing, as well as the implications that come along with patients doing this kind of testing in order for them to make an informed decision. Nurses are also responsible for providing support if the test does show that their biomarkers signify a high risk, and with that, they will most likely be responsible for the majority of the coordination with other disciplines, such as therapy, counseling, case management, so patients can maximize their independence and comfort to decrease their mental burden and the anxiety that they face. If the patient does decide to proceed with testing, the nurse will be responsible, or most likely will be responsible for the coordination of preventative care, emotional support, and care as the disease progresses, as that is a given, as well as nurses are also play a critical role in providing patients information on the importance of this testing and explaining how it is non-invasive and preventive, and also providing education that neurodegenerative diseases are now taking on a more preventative role or stance rather than a reactive, so that testing is done more so to prevent the progression rather than treating it as when it is already present. To conclude, ALS is an irreversible neurodegenerative disorder, and it's characterized by the loss of muscle control, and this can be seen through, in the beginning, muscle twitching, which can progress to slurred speech, trouble swallowing, trouble breathing in the end. There are new blood-based biomarkers that can be tested for that can predict ALS symptoms before they emerge, according to a new NIH study. This demonstrates a shift on ALS being treated more preventatively rather than reactively. With this come implications to patients and their family members, as they may have to deal with the psychological burden of knowledge and the costs of testing, depending on their insurance. It also brings about implications to families as they have to factor this knowledge in with their reproductive choices, and as well as the implications to healthcare workers as they must provide emotional support and specialist referrals throughout disease progression. There are many legal and ethical concerns that come with this new blood-based biomarker testing, which are focused on the higher premiums and the complications that could arise for patients who do choose to go with this testing, and overall the issues that come with the costs of this sort of testing and the availability to patients, especially ones who already have a higher risk or predisposition to ALS. And it can also lead to severe psychological burden or the burden of knowledge if the patient does come back as high risk for ALS. And nurses are imperative for patient and family education in regards to this testing, and as well as providing appropriate guidance to patients who choose this testing. And this is before and after, regardless of the results of said test.